Hi, my name is Crystal Sylvain, and I will be talking about the effects and rebuilding patient care. Wellstar Atlanta Medical Center was built in 1901. It was also known as Georgia Baptist Convention in 1913. The convention was sold to Tenet Healthcare and was renamed Atlanta Medical Center. It is the second largest hospital in Georgia. Wellstar Atlanta Medical Center is considered a Level 1 trauma center, advanced primary stroke center, and Level 3 neonatal ICU. Wellstar offers neurocare, emergency care, women's health, rehab, imaging, inpatient and outpatient care, and more. When it comes to patient volume, it's low because every new insurance companies want to cover medical treatment due to the deductible being high in the beginning. Staffing issues is where there's not enough nurses to take care of the patients due to the COVID pandemic. Prices are increasing on exams every year, and when volumes are down, the prices increase. Patient satisfaction surveys is where the patient scores are based on our facility, if it's clean, if the patient would recommend this facility to go to, delays on being seen, if the medical staff help the patient explain the procedure, listen to the patient, and also if the medical staff wear masks and if the medical staff tells the patients when their results are ready. When it comes to crowded emergency departments, emergency rooms had a high capacity for COVID patients. The nurses had to put some of the patients in the hallway until the room was available for them. Even patients with diseases were more advanced were coming to the hospital. When it comes to higher expensive, due to certain procedures were being expensive in general, fewer outpatient visits is due to patients being afraid to come to the hospital because of COVID. Utilizing personal protective equipment is where the hospital spends more money on gowns, gloves, masks, and shields to protect themselves and the patient. Wellstar also do screenings for COVID. This is where any visitors that come to our facility, Wellstar staff would have to check their temperature to make to make sure they do not have COVID due to that being one of the symptoms. Also, Wellstar wants vaccine being mandatory. Wellstar wants all employees to be vaccinated. If they're not vaccinated, they'll be terminated from the job. Key quantitative indicator. Wellstar is spending more money on personal protective equipment. Wellstar also furloughed more than 1,000 employees in addition to reducing the hours of employees. This caused millions of losses due to COVID. Also, the prices on the personal protective equipment has increased. Now the N95 mask, it used to be 38 cents, now it's $5.75. Gloves used to be 2 cents, now it's 6 cents. Gowns used to be 25 cents, now it's $5. Face shields used to be 50 cents, and now it's 4 cents. Porter's five forces. When it comes to competitors, both hospitals had different innovations. Wellstar innovation was new health policies, practices, system, products, and technologies, and services to improve healthcare. Piedmont Hospital innovation was to deliver treatments and set a new standard for excellence in care. When it comes to suppliers, there was a shortage of medical suppliers and drugs. Supply chain shortage affected the US healthcare while significant prices increased. When it comes to buyers, there was a dispute agreement between Wellstar and United Healthcare Insurance because they no longer have access to in-network care and services from Wellstar hospitals and physicians. Piedmont Hospital had a dispute agreement with Blue Cross Blue Shield reimbursement costs, which affected in-network care providers. In-network providers are cheaper than out-network. Medical providers get paid by insurance or government payers through a reimbursement system. When it comes to substitute, Wellstar and Piedmont provides community health services. This is a way to help people afford health insurance, reduce costs due to preventable chronic conditions, and support their workforce needs. Also, new entries. Due to people having chronic or long-term condition and the aging population, medicine prices increases along with procedures and the cost of technology. Change initiative overview. Wellstar has a new project they're launching, which is called Catalyst. Catalyst, Catalyst is a global digital health and innovation center. Its purpose is to address harnessing problems, solutions, investments, and partnerships across industries. Catalyst is a technology to better patient care and provide an excellent experience for the patient. Things that are included on Catalyst is digital health, which boosts the efficiency of healthcare delivery, customer experience, which builds a relationship with the patient by interacting with them, along with keeping them happy. We also have data analytics security, which ensures that the computer networks and system protects people from hackers and viruses. We also have sustainability, which enhance quality care without harming the environment. Supply chain, logistics, and mobility, its responsibility for sourcing, processing, and delivering goods to customers. Last but not least is future of works, which is exceeding on patient care. The digital designer would be the one to make the website, graphics, email templates, and more, followed by a business analysis and a software designer, who would be some of the people we would have to pay that falls into the salary, which is $490,000. Two things that will be expensive are building of technology, which is 4,900. I'm sorry, 4,090,000, and the designer, which is 240,000. This overall estimate total is this overall estimate total for this project will be 850,365. This technology will empower consumers to provide information access to healthcare solutions and enhance health and wellness. The goal is to enhance healthcare experience, reduce human errors, improve clinical outcomes, facility care coordination, improve practices efficiencies, and track dates over time. Change initiative analysis. When it comes to communication, patient experience can be affected by communication between providers and patients. Medical staff must make a connection with the patient. When it comes to patient safety, there can be wrong diagnosis for the patient's treatment. This is where we have to track and report consultation and diagnostic testing. When it comes to cybersecurity risks, medical information can get into the wrong hand. The control system access granted to only Wellstar employees and no one else. Inaccurate data is where you have incorrect and incomplete information. Medical staff must check MRN for the right patient along with name and date of birth. Ethical analysis. Disclosure of personal information could cause professional or personal problems. This is where we recommend to create policies and confidentiality agreements so that everybody on the medical team knows exactly what is expected of them and everything that they do. We keep medical information private, also making sure all information is stored on secure systems, respecting patients' confidentiality and privacy, which is patients' rights. Also keep information and records physically and electronically secure and confidentiality. Building support. Some of the people that support supports WellStar is physician assistant, nurse practitioner, surgeons, cardiologists, nephrologists, oncologists, neurosurgeons, and nurses, just to mention a few of the support team. Ambivalence is where patients get defensive coming to the hospital due to something going on in their personal life. You want to respond with care and concern. When it comes to opposition, competitors will try to offer more highly trained support staff or better equipment to make the facility stand out from others. Building support. The lead time is 98% and the process time is 49%. Implementation. When it comes to employees' engagement, lead to a higher patient satisfaction rate, increased patient safety, and improved quality care. When it comes to communication and collaboration, you want to build a relationship with your fellow coworkers. When it comes to sustainability, promote leadership and environmental health by supporting human rights. When it comes to problem analysis, give faster and more accurate diagnosis and more personalized treatment and more informed decision making. Last but not least, quality safety. Lessen the threats of legal action when it comes to safety and pay attention to details and accuracy. Key success factor. Things about quality care is that you want to avoid harm, which is making the patient feel safe and comfortable, being effective. You want to provide quality healthcare to everyone. Patient-centered care. You want to focus on healthcare needs, preferences, and values. Timely. You want to reduce wait time and delay in care. Efficient. With the technology, it retrieves patient information quickly and conveniently. Customer service. Understanding patients' condition and treat them with empathy. Last but not least, communication is a way to protect patients and reduce medical error. Matrix. When it comes to patient safety, you want to be alert at all times, which is performing tasks and direct observation of patients and colleagues to minimize safety risks. Well-being, you want to make good decisions and health choices. Error, WellStar is preventing patients resulting to lawsuits. Feedback is a way to improve any services and keep the patients coming back to WellStar. Complaints are something that our facility will have to improve on based on patient survey. WellStar is building patient volume by making it not turn away. Patients due to their insurance not covering for medical procedures. Hiring more nurses due to low staff during the pandemic and offering more money and a bonus to the services of all medical staff. Having a new technology can reduce inefficiency, improve access to medical information, and increase quality in healthcare. Strategies that are in place to enhance patient care is AIDED. So AIDED stands for A, acknowledge, I, introduce, D, duration, E, explanation, and thank you. This is a way of communicating with our patients. And this concludes my presentation. Thank you.